Hello, everyone. Welcome back. Today, I'm going to answer a few questions about checking finger stick. These are common and important questions. Question number one, somebody is asking, they are afraid to check the finger stick because of the pain that can be involved. First of all, the best way to avoid pain is to check the finger stick in the right manner, in the right way that we discussed before. A few things that I see people doing wrong that can cause more pain than it should is if they check the finger stick from the ball of the finger rather than from the side of the finger. That's a common mistake. Most people intuitively or think that the right way to do it is from the ball of the finger. Now, the problem with this is that we have a lot more pain receptors in this area of the finger, that pad, than we do on the sides. And so if you check here, you'll have more pain from checking, but also the more you go through your day, you utilize this pad a lot. So if you're keep on checking the finger stick from here, and then you're using the fingers to type or to touch or to hold things, then of course, every time you hold something or touch something, you will feel a little bit of the effect of the finger stick. It's not severe, of course, but we're trying to minimize any pain. So the best way to do it is from the side of the finger, because you don't utilize the side like you use the pad. The second way to avoid pain or minimize it is to use a sharp needle, which is a little bit counterintuitive because you would think sharp, oh, it is going to hurt more. No, actually, to use a sharp lancet, which is an unutilized lancet or a new lancet, that actually causes less pain. It's when you're trying to economize and use the lancet over and over and over again, it becomes blunt, it becomes more painful. The third way to avoid pain is to basically be sure that you are utilizing the right penetration on the lancing device. We talked about this in the first video, is that the penetration of the lancing device, it's meant to how much is needed to penetrate the skin. Now, a lot of people, in trying to not hurt themselves, end up hurting themselves in the sense that they do the penetration very low, thinking that that wouldn't hurt, but then they feel the prick. However, they can't get enough drop of blood, so they have to repeat the process over and over and over again. So instead of one stick, it becomes 4 or 5 sticks, adding to the pain and discomfort. You want to set the sensitivity of the lancing device to the correct measure, and a good place to start is in the middle. Very few people will have such a thin skin that they only require the first level of penetration to be used. The second question is an important one, also about the control solution. Now, this is probably a question from people who are used to the older systems of test strip checking, where you had this control solution, and the idea is that it was set up to give you a certain reading on the blood sugar. So if you took that control solution and dropped it on a test strip, it would give you a number, and it's supposed to be, the number is supposed to be something written on the box, like 125, for example. And if you get that number of 125, then it means your test strips are good. If not, then you have to adjust something on the machine to make it get to 125. Luckily, we don't have to do that anymore. I'm just answering the question for people who might have that memory from the older systems that had a control solution. Since people are not interested in doing chemistry in their own homes, and the companies that make the glucometers understand that, they came up with test strips that do not require calibration or constant checking or control solutions. And thank goodness, because I don't know about you, but I'm not a big fan of chemistry. Apology to all the chemistry teachers out there. Question number 3 is results. What are the cutoffs for diagnosis of diabetes and for prognosis of diabetes, or monitoring the blood sugar? What am I looking for? Okay, so there is an important caveat before I tell you. That important caveat is that you cannot use the results of a finger stick to diagnose diabetes. Why? Because it has to be diagnosed on a venous blood test. There is a lot that could go wrong in the finger stick. We mentioned one thing on previous episodes, which is that the test strip could be old and expired and give you mistakenly high reading that will trick you to thinking that you have higher numbers than you actually do. So you can only diagnose a diabetes or pre-diabetes on a venous sample, on a blood draw, not on a finger stick. And the second reason for this is because the cutoffs between pre-diabetes, diabetes, and normal blood sugar are very thin. So, of course, they are very, very small. So a finger stick that gives you 5 points more than the actual venous blood result can trick you into thinking you are in a category that you are not in. I'll give you more concrete examples. For example, a normal fasting blood glucose. I'm talking about people who were not diagnosed with any condition related to blood sugar. They just went to the lab and had a venous blood draw after 8 hours of fasting. What level diagnoses normal blood sugar versus pre-diabetes versus diabetes? If the glucose level on that venous sample is less than 100, that's normal. If it is between 100 and 125, that is what we call impaired fasting glucose, which is one of the forms of pre-diabetes. And if the glucose is 126 or more, that constitutes a diagnosis of diabetes. Okay, so as you can see, the cutoffs, of course, have to be made to make some line in the sand where, you know, the diagnosis is made beyond that line. But as you can understand, the differences can be small. So somebody who has normally on a blood test, a venous blood draw glucose of 99, but when they check the finger stick, they find it to be 105. They may be concerned thinking that they have pre-diabetes, where in fact, it's simply the glucometer happened to give them a higher reading than their actual venous blood draw. So you cannot make conclusions as to the diagnosis based on a finger stick. The cutoff for monitoring somebody who already has diabetes, what are the cutoffs for that? Now, of course, it depends on how strict you want your blood sugar control to be and how feasible it is to control the blood sugar that strictly. So it depends a little bit on each person. But as a general rule, the recommendation is for the fasting glucose level to be between 90 and 130 milligrams per deciliter. And if you check the blood sugar 2 hours after eating or during the day after like several hours after a meal, then the expected result should be between 100 and 180 milligrams per deciliter. So anything above 180 would be considered excessive or too high. And a fasting blood glucose above 130 fasting is again considered a bit too high. Again, these are things that have to be individualized according to people and what their risks are, what medications are. Some patients, we have to relax these numbers in order to avoid dropping the blood sugar too much. And in some patients, they can achieve stricter control. So we would tell them that, 180 2 hours after the meal is still too high for you, because you really, can't be expected to get numbers up to just 140 after the meal and not more than that. So it depends on the person. Don't make conclusions pertaining to yourself or your health before talking to your particular specific doctor who knows your situation. Okay, now another question is, well, I checked my finger stick and I found the result to be different on different machines, or I checked my finger stick and I found the result to be, different compared to my my continuous glucose monitoring system, or I checked my finger stick and used the same machine 5 minutes later and checked again and found a completely different result. Okay, I'll talk more about the continuous glucose monitoring systems in the series that I will make about the CGMs. But now regarding the finger stick itself, there is going to be fluctuation. These things are not exact to a T. There is some discrepancy between the readings of different machines, between the readings of different test strips, and between your own blood sugar at different times during the day. Now, what is the discrepancy expected to be within, like if you check one same blood drop from one person, right, on two different good machines, what should the discrepancy be that is allowed? It's within 10 points, right? So if you're having your finger stick checked on one machine and it gives you 119, for example, then the acceptable range of discrepancy should be between 109 and 129, right? Now that sounds like a big range, and it is, but it takes into account different machines, different technologies. Now notice that in real life, that range is not static. It changes or differs depending on where your blood sugar is. For example, in a normal glucose level, that difference would normally be less. So if the blood sugar is normal, in the normal range, let's say it's 119, normally you would expect when you check it on a different machine to be maybe 123 with the same blood drop, 123, 122, 117, something like this, right? So you would expect the change or discrepancy to be minimal. But the more you go into the extremes, the more you expect the discrepancy to be. So in low blood sugars, machines are notorious about having big discrepancies when the blood sugar is low. So somebody may have a blood sugar of 65 on one machine, and on another machine, it may say low, LO, which depends on the machine, could mean less than 50 milligrams per deciliter or less than 60, depending on which machine. You could have a discrepancy of 20 points. One machine reads 43, another one reads 65 or 66. And that actually is a well-known issue to happen when the blood sugar is low, particularly. Same problem, maybe to a less extent, when the blood sugar is high. So a blood sugar of 402 on one machine could very well be measured at 430 on a different machine from the same drop of blood, because again, in the extremes, the machines are not very accurate. So that discrepancy tends to go up in the extremes, whether the high or the low. Another question is, well, technically, how many test strips can you get per box? And how should it be prescribed by the provider? So typically a box has 50 test strips. And there are some, test strips that can have like boxes of 100, but the typical number is 50 test strips in a box. And I told you previously about the rules of Medicare for coverage. So if somebody's checking finger stick 1 time a day, the Medicare would allow them to have 100 test strips for 90 days. And if they are checking 3 times a day, then Medicare would allow them to have 300 test strips for 90 days. Of course, they are not going to, be petty to that point of saying, oh, you only need 270, we need to break the box and just give you 20 out of a box, all of that. No, they're just going to allow 100 for 90 days for 1 check per day, and 300 for 3 checks per day for somebody who checks three times per day. I hope this has been helpful. If you have more questions, let me know. And in future episodes, we're going to talk now about continuous glucose monitoring systems. So please be tuned. Have a good day.